I'm really pleased to say that we are now implementing tobacco dependency treatment services across every hospital in England, whether that's an acute hospital or a mental health trust. For the first time ever, we are going to go about identifying every person that smokes who comes into hospital and treat them for that tobacco dependency, breaking that cycle between addiction and poor health. In this video, we hope to take you through the elements of this pathway, whether that's identifying somebody who smokes, providing NRT, referring to a tobacco dependency advisor, or following up with them in clinic or in the hospital when you next see them.
We need to ask every adult inpatient whether they smoke, and by that we mean whether they've had a cigarette within the last 2 weeks. And then just as importantly, we need to record this in their medical records so that we've got an accurate picture of where the smokers are within our hospitals. We know that most adult smokers want to quit, but most haven't sought help. And so by asking and recording, we're empowering them to receive the best possible care whilst they're in from our tobacco dependency advisors and get help at least with temporary abstinence and hopefully with a quit attempt.
The large majority of smokers have tried to stop before, usually many times. There's only one thing that's preventing them from succeeding, and that's nicotine. Cigarettes deliver nicotine to the brain extremely rapidly. Nicotine acts on key midbrain pathways, going from the ventral tegmental area to the nucleus accumbens, leading smokers to crave cigarettes in situations where they would normally smoke, and when nicotine levels in the brain become depleted. It doesn't force people to smoke, but it creates a strong need to smoke that's hard to resist. With willpower alone, the chances of long-term success of a serious quit attempt in hospital patients is less than 5%. However, every quit attempt can be thought of as a roll of the dice, and so no matter how many times a smoker has tried to stop before, they have a chance to succeed the next time they try. Equally importantly, we can dramatically increase their chances of success with treatment. We know what to do to give smokers the best chance of success at stopping. It's a combination of behavioural support and one of the several proven medicines. Both are essential and they work together. The most widely available medicine is nicotine replacement therapy. Nicotine skin patches, lozenges, inhalers, chewing gum and others. They provide nicotine in a safe and less rapid form, easing the transition to becoming nicotine-free and tobacco-free. They don't guarantee success at stopping, but used properly, they dramatically reduce the cravings and other withdrawal symptoms such as depressed mood and irritability. And together with behavioural support, they've been shown in more than 100 randomised placebo-controlled trials to dramatically improve a smoker's chances of staying off cigarettes permanently. The optimum NRT treatment is the 25mg nicotine skin patch to provide background level of control of cravings and withdrawal symptoms, plus one of the faster acting forms such as the 4mg gum and inhaler to tackle breakthrough symptoms. These should be prescribed in 4-week blocks for up to 12 weeks.
You will have local pathways for onward referral on an opt-out basis to your tobacco dependency team. For some, this may be automatically triggered when you record smoking status, otherwise you may need to make a separate referral. But either way, encouraging your patient to meet with a tobacco dependency advisor will both ensure that their temporary abstinence is well supported, which may in turn prompt a quit attempt later during their stay or in the future, but gives them all the opportunity to have a high quality specialist tobacco dependency advisor consultation to give them advice about making a quit attempt, discuss NRT, vaping, and ensure appropriate referral on to community services on discharge.
I hope you've now become a little bit more confident with the treatment of tobacco dependency. When people come into hospital, we want to identify whether they smoke. We want to provide NRT to stop that craving for nicotine and treat that temporary abstinence, and provide NRT when they go home so that they don't relapse to smoking. We want to refer patients to our in-house tobacco dependency advisors, and we want to follow up with patients when we see them back in clinic or back in the hospital to see if they need any other support. So I hope you're all feeling much more confident with breaking this cycle of tobacco dependency, ill health and mortality.